Hi, my name is Alessandra Bais, and I'm doing the Kyle Reeves Focus Lung Assessment. We are going to start by collecting subjective data. So I'm going to check the patient's identification with their wristband and their birth date and name.
My name is Kyle Reeves. I'm 16 years old,
What's your birth date?
June 1st, 2006.
Okay, so his armband matches what he says, so we have our correct patient. Um, we're going to start by asking Kyle, how long have you felt unwell?
4 days.
Have you been doing anything to make yourself feel better?
Yes.
Um, have you had shortness of breath?
Yeah.
Have you been experiencing chest pain?
No.
Do you have any, is there anything that makes your cough worse? Or do you have a cough?
Yeah.
Is there anything that makes your cough worse?
No. I don't know.
Is there anything that makes it feel
I don't know.
better? When you cough, is it a productive cough or is it dry?
It's phlegmy.
Um, have you been following your medication regimen at home?
No.
Okay, why not?
I just don't really want to all the time.
We would educate the patient on how important it is to follow his medication regimen. How is your diet?
So.
All right. Do you drink enough water?
Uh, Pretty normal, I think.
Okay, so we've collected our 10 subjective data for that, and then we're going to move on to objective data. I'm going to start by doing his vitals. So I'm going to assess his respirations, which were 18, and then we're going to assess his temperature with a temporal or oral thermometer, axillary, whichever. And he's got a normal temperature, slightly elevated, actually. I think it was 101.9 in the chart. And then we're gonna assess his oxygen saturation, which is 89% at room air. So we're gonna go ahead and put 2 liters nasal cannula on him. And then we're gonna assess his heart rate, which was 90. And then we're going to assess his blood pressure, which was 118/78. So those are all within the normal range. The temperatures are slightly elevated. And then we're going to move on to assessing the patient's breathing. So we're going to look for symmetry in the front while he's breathing. We're going to assess whether he's using accessory muscles, which his breathing is slightly labored. We're then going to note while we were collecting subjective data if the shortness of breath was affecting him being able to speak full sentences or not. And then we're going to listen to his lungs in a zigzag pattern on the anterior and posterior while assessing for symmetry and equal chest rise and fall. Go ahead and take a deep breath. Deep breath. 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 Deep breath. Deep breath. So we're going to note that there is wheezes on the left side anteriorly, and then we're going to listen to the posterior in a zigzag pattern as well. Just lean forward a little bit. Take a deep breath. Breath. In. 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 One more time. And then one last one. So we're going to know also that there was wheezes on the posterior side as well in the middle and lower lobes due to the patient's cystic fibrosis. We're then going to make sure the patient's comfortable, call lights in reach, um, make sure all needs are met, perform hand hygiene, and document our subjective and objective data.